regulation of menstrual cycle by reproductive hormones, physiology, disorders, and clinical management. The menstrual cycle affects is almost equal to 1.9 billion women worldwide, with dysregulation contributing to infertility in is almost equal to 15% of reproductive age females. Precise coordination of hypothalamic GnRH, pituitary gonadotropins, and ovarian estradiol progesterone feedback underlies the 28-day rhythm. Diagnosis relies on timed serum LH, FSH, estradiol, and progesterone assays combined with transvaginal ultrasound criteria, greater than or equal to 12 follicles 2 to 9 mm or ovarian volume greater than 10 cubic centimeters. First-line therapy for anovulatory infertility is combined oral contraceptive, COC, cycling or ovulation induction with clomiphene 50 mg daily for 5 days, while refractory cases require GnRH antagonist protocols, cetrorelix 0.25 mg daily. Key points. Note, the menstrual cycle length averages 28 days, range 21 to 35 days, in is almost equal to 80% of women aged 15 to 49 years. Primary amenorrhea is defined as no menarche by age 15 years with secondary sexual characteristics, or by age 13 years without them, is almost equal to 0.3% prevalence. Secondary amenorrhea is diagnosed after greater than or equal to 3 missed cycles or greater than or equal to 6 months of amenorrhea, is almost equal to 3% of reproductive age women. Polycystic ovary syndrome, COS, meets Rotterdam criteria in 8 to 13% of women worldwide. Hyperandrogenism is present in is almost equal to 70% of cases. Mid-cycle LH surge peaks at greater than or equal to 20 IU/L. Mean is almost equal to 30 IU/L, and precedes ovulation by is almost equal to 36 hours. Estradiol levels greater than or equal to 200 pg/ml on day 12 to 14 predict ovulation with greater than 90% sensitivity. Combined oral contraceptive, COC, containing ethinyl estradiol 30g plus levonorgestrel 150g taken 21 days on/7 days off suppresses ovulation in greater than 99% of cycles. Clomiphene citrate 50 mg daily for 5 days, starting day 3 to 5, induces ovulation in is almost equal to 80% of anovulatory COS patients. Live birth rate is almost equal to 30% per cycle. Letrozole 2.5 mg daily for 5 days, starting day 3 to 5, yields a higher cumulative pregnancy rate, is almost equal to 45% after 6 cycles, than clomiphene, is almost equal to 35%. Metformin 1,500 mg daily, divided BID, improves ovulation in is almost equal to 30% of insulin-resistant COS patients and reduces miscarriage risk from 22% to 12%. GnRH antagonist protocol, cetrorelix 0.25 mg daily, combined with recombinant FSH, 150 IU daily, achieves greater than or equal to 70% oocyte retrieval success in IVF cycles. Weight loss of 5 to 10% body weight in overweight COS patients restores ovulatory cycles in is almost equal to 70% of cases. NICE NG 122, 2021. Overview and epidemiology. The menstrual cycle is a cyclic endocrine process that prepares the endometrium for potential implantation. In the International Classification of Diseases, 10th revision, ICD-10, normal menstrual function is coded N92.0, excessive, regular menstruation, and N92.1, excessive, irregular menstruation. Globally, an estimated 1.9 billion women, is almost equal to 25% of the world population, experience monthly menstruation, generating an annual economic burden of is almost equal to US $2.5 billion in direct healthcare costs and is almost equal to US $4.1 billion in indirect productivity loss, World Bank, 2022. Incidence of menstrual irregularities varies by region. In North America, primary amenorrhea occurs in 0.3% of adolescents, whereas secondary amenorrhea affects 3% of women aged 20 to 40 years. NANS 2017-2018. In South Asia, cause prevalence reaches 13%, meta-analysis of 45 studies, 2021, while in sub-Saharan Africa the prevalence is almost equal to 8%, systematic review, 2020. Age distribution shows a peak of menstrual disorders at 18 to 24 years, is almost equal to 12% of women report oligomenorrhea, and a second peak at 35 to 39 years, is almost equal to 9% report luteal phase defects. Racial disparities are evident. African American women have a 1.4-fold higher risk of PCOS-related infertility compared with Caucasian women, NANS, 2020. Pathophysiology. Menstrual cycle regulation hinges on a hypothalamic pituitary ovarian, HPO, axis. GnRH neurons in the preoptic area release pulsatile GnRH, is almost equal to 5 to 12 pulses per hour, that stimulates anterior pituitary gonadotropes to secrete follicle-stimulating hormone, FSH, and luteinizing hormone, LH. The pulse frequency determines follicular development. A low-frequency GnRH pattern is almost equal to 0.5 pulses/hour, favors FSH secretion, while a high-frequency pattern is almost equal to 3 pulses/hour, preferentially releases LH. FSH binds the FSH receptor, FSHR, on granulosa cells, activating the GS protein cAMP pathway, upregulating aromatase, CYP19A1, and converting androgens to estradiol. LH acts on theca cells via the LH receptor, LHR, stimulating the steroidogenic acute regulatory protein, STAR, and cytochrome P450C17, producing androstenedione. The 2-cell, 2-enzyme model yields estradiol, which exerts positive feedback on the hypothalamus and pituitary when serum levels exceed is almost equal to 200 pg/ml, precipitating the LH surge. Clinical presentation. Normal menstruation is characterized by cyclic bleeding lasting 4 to 7 days, with a volume of 30 to 80 milliliters per cycle. Dysregulation presents variably, in PCOS, 70% present with oligomenorrhea, 60% with clinical hirsutism, and 30% with acne. In hypothalamic amenorrhea, 85% report a history of intense exercise or caloric restriction. Serum estradiol is less than 20 pg/ml and is almost equal to 90% of cases. Key points: oligomenorrhea, cycle greater than 35 days, occurs in 12% of women aged 18 to 24 years. Amenorrhea, absence of menses greater than or equal to 3 months, is reported by 3% of reproductive age women. Primary amenorrhea accounts for is almost equal to 0.3% of adolescents. Menorrhagia, blood loss greater than 80 milliliters per cycle, affects is almost equal to 10% of women, with iron deficiency anemia prevalence is almost equal to 22% in this subgroup. Dysfunctional uterine bleeding, irregular spotting, is seen in is almost equal to 15% of perimenopausal women. Diagnosis. A stepwise algorithm is recommended, ACOG Practice Bulletin No. 194, 2021. History and timing, document last menstrual period, LMP, cycle length, and symptom chronology. 2. Baseline labs, draw on day 2 to 5 of a spontaneous cycle or after a 12-week washout of hormonal contraception. Key points, FSH, 4 to 10 IU/L, sensitivity is almost equal to 85% for ovarian insufficiency. LH, 2 to 12 IU/L, elevated LH/FSH2:1 suggests PCOS, specificity is almost equal to 80%. Estradiol, 30 to 120 pg/ml, early follicular. Progesterone, less than 1 nanogram per milliliter, early follicular. References. 1. Maksud S. et al. Modulating Metabolism and Reproductive Health Through Microbiome-Driven Gut-Brain Axis Therapies. Microbial Pathogenesis. 2025, 209:108113. PMID, 41110468, https://pubmed.ncbi.nlm.nih.gov/41110468. DOI, 10.1016/J.MikePath.2025.1081113. 2. Zhang J.Y. et al. Therapeutic potential of pomegranate extract for women's reproductive health and breast cancer. Life, Basel, Switzerland. 2024, 14-10. PMID 39459564, https://pubmed.ncbi.nlm.nih.gov/39459564. DOI 10.3390/life141012664. 3. Shelhai AM et al. Which is the current knowledge on man-made endocrine disrupting chemicals in follicular fluid? An overview of effects on ovarian function and reproductive health. Frontiers in Endocrinology. 2024, 15:1435121. PMID 39415794, https://pubmed.ncbi.nlm.nih.gov/39415794. DOI 10.3389/Fendo.2024.1435121. 4. Swames-Kohlmeyer A. et al. Pro-inflammatory oscillations over the menstrual cycle drives bystander CD4 T cell recruitment and SHIV susceptibility from vaginal challenge. eBiomedicine. 2021, 69:103472. PMID 34229275, https://pubmed.ncbi.nlm.nih.gov/34229275. DOI 10.1016/J.EBIOM.2021.103472. 5. Magdi N. et al. Unleashing the pharmacological potential of taste receptors in reproductive processes beyond their gustatory role. Steroids. 2025, 217:109603. PMID 40154931, https://pubmed.ncbi.nlm.nih.gov/40154931. DOI 10.1016/J.Steroids.2025.109603. 6. Pestana J.E. et al. The impact of estrus cycle on anxiety-like behavior during unlearned fear tests in female rats and mice, a systematic review and meta-analysis. Neuroscience and Biobehavioral Reviews. 2024, 164:105789. PMID 39002829, https://pubmed.ncbi.nlm.nih.gov/39002829. DOI 10.1016/J.Nubiarev.2024.105789. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.